We talk a lot on this show about showing up as your best, on the job, at home, and for your team. But you can't pour from an empty cup. The Recharge Room gives first responders access to tools that actually work. Infrared sauna, cold plunge, red light therapy, and vagus nerve stimulation to knock you out of fight or flight and into real recovery. This was built for us by people who understand our world. Check it out at rechargeroom.io. You train for the threats you can see, but what about the ones you can't? United Diagnostic Services brings hospital-grade diagnostic technology directly to first responder agencies, making early detection of cardiovascular disease and cancer more accessible than ever. UDS provides comprehensive early detection programs using advanced ultrasound, CT calcium scoring, stress echoes, and innovative blood panels to identify potential health risks long before symptoms appear. It's proactive, on-site, and built specifically for those who serve. Early detection saves lives and careers. Learn more at udshealth.com. The views and opinions expressed by the host and guests of this show do not represent their employing agency, department, or organization. All information should be regarded as anecdotal, contextual, and educational, and should not be misinterpreted as legal or medical advice. Welcome to Blue Grit Radio, the podcast that explores making better cops for a better community. I'm your host, Eric Tung. I've been an active police officer since 2007. We will dive into the aspects of police culture, health and wellness, leadership, and mindset. You'll hear from experts not only from policing, but all industries as they relate to being our best with purpose, passion, and positivity. Join me as we share stories, lessons, and advice so we can all be better for ourselves, our teams, our families, and our communities. All right, welcome back. We're here with Dr. Brooke, returning guest Dr. Brooke Bartlett. Brooke, welcome back.
Thanks for having me back. Happy to be here.
I know, it's third time, is that right? I have some notes. Episode 63, we talked about trauma, family impacts.
Third time. I thought it was
63.
two, but you're right. I came on to talk about losing like a pet or a canine.
Yeah.
Yeah.
Pet grief. Canine, I reflected personally. You reflected personally on some trends there, things that you've helped people work through as well. That was episode 115. So what is this one going to be? It's going to be like 240-ish, between 240 and 50. So you're at 63, 115. Yeah, so we have a kind of decently spaced interval. So it's been a little bit.
Yeah. I mean, next will come on 375 or something. So yeah.
I know. Yeah. Well, I really appreciate you coming back on. You're a very popular guest. You know your stuff, very clear in how you teach us. So I'm excited to talk about, I mean, it's not an exciting, fun topic, of course, but moral injury. But we've had guests talk about moral injury on the show. I like your take. You actually, at the time of recording, late June, you just put out a post outlining 3 main pathways. And so before we get into that, for those that haven't listened yet or newer listeners, can you please give us a little intro of yourself, what you do, and then walk us into moral injury?
Yeah. So I'm Dr. Brooke Bartlett. I'm a public safety and military psychologist. So that means I spent all of my years of training, specifically specializing in working within public safety and military, both on the clinical side, meaning therapy, but also developing wellness programs and working within embedded within the departments and contracting with departments to just help them build out, let's say, peer support programming, ongoing resources for critical incident response, etc. So that's what I do full time now too, and my own work, my own business. So working with departments across the country. So that's just a little snapshot of me and what I do. And then, yeah, you want to just go right into talking about some moral injury?
Yeah, let's go. What is moral injury?
Yeah. So moral injury is something that is highly prevalent in public safety professionals, but not particularly well understood at this point. There's a lot of research coming out now, specifically in first responders looking at moral injury. So I think awareness will continue to build, but it's still very under recognized. So when we think of moral injury, think of it as something that can develop after someone perceives that they've transgressed their moral code or value system in some way. Now, a big underline here that I want to word that I want to underline here is perceived. So you're going to continue to hear me say this word perceive because it's very important. Someone's perception of doing wrong is not necessarily equivalent to they actually did something objectively wrong. But if someone
Hmm.
perceives that they have either directly done something that violates their moral code, or as we'll talk about, failed to prevent something that they think they should have prevented, that in and of itself can be a violation of perceived violation of moral code.
Yeah. No, that's a great snapshot. And quickly, I think a lot of listeners, if they're not familiar, they'll start thinking of examples. And I
Mhm.
think this ties in, the word is similar. I think it ties in extremely closely, interweaves with morale, right? Because we all signed up to do this thing. The young, bright eyed version of us signed up to change the world, make a difference. And after so many iterations and so many times, you keep kind of spinning your wheels in this job. And that same problem intersection seems exactly the same, even the business names have changed. And it is to say that you can't do everything, but then at the same time, with law changes, you feel like there's so much that you want to do, could/should do, and that should creates this undue pressure often amongst ourselves.
Yep. Yep. Absolutely. And I actually referred to your article, a lot of officers to your article that you wrote,
Mm, thank you.
um, because there's some really good examples of moral injury and specifically how some of the, like you're saying, the policies and changes in law and things like that can influence um, or increase risk in some cases for moral injury, depending on certain situations.
Yeah, absolutely. So you carved out three pathways, kind of illustrating how one can find themselves in this environment, this morally injurious environment where we're reflecting on the situation and we find this discord with our own value system.
Yeah. So I'll talk about the three pathways that lead to moral injury, and I can give some examples of each too. So the three pathways to moral injury, meaning this is the three different ways that someone can eventually develop moral injuries. The first is when someone perceives that they have directly done something that violates their moral code, like they have directly engaged in some kind of action that violates their moral code. We call this acts of commission. The pathway to moral injury through acts of commission. So some examples could be subduing a suspect and causing bodily harm that maybe to a degree that someone didn't want to um, uh, cause. It could be in pursuit. An innocent civilian is harmed. I've worked with officers, for example, who are in pursuit, hit a civilian car and someone died. A civilian died in the car. They had moral injury from that, blaming themselves. I took an innocent life. I've worked with military veterans that in the active combat or in response to some kind of ambush, they killed a child or killed a civilian that was in the crossfires, for example. So those would be some examples of the pathway through acts of commission. Of I perceive that I've directly done something that then violates my moral code. So second pathway is when someone perceives that they didn't do enough. Okay. So they perceive that they didn't do enough during some kind of event and or that they didn't do enough to prevent this bad thing from happening. Okay, should have prevented some kind of outcome that they didn't some terrible outcome that happened. And we call this acts of omission. Okay. And I really like to highlight this because I'd say, and this is just anecdotal with my first responders, uh, acts of commission, meaning like I believe I directly done something, definitely happens a lot. But I'd say I see more so through the pathway of acts of omission, which is that I perceive that I didn't do enough. I should have done more. Eric, you have a great example in your article about moral injury that would fit into that pathway. So changes in policy around limited pursuits, right? So this person's beaten on their wife, but because of those policies, you're not really allowed to do anything about it. You have to, you're not allowed to continue pursuing this individual, and then you find out a couple weeks later that he finished the job and his wife is no longer alive, right? So an officer blames himself. I should have done more. I could have done more. That would be an example of acts of omission. Um, you know, uh, I've worked with, I mean, I could give a million examples of this. An officer responding to the scene of a drowning child, and they tried to run through the front door, but the front door was locked, and so they jumped over the fence. The child was already not going to make it, but they blamed themselves, saying, if I had just gotten there 2 seconds sooner, I should have just jumped the fence in the first place. Why did I try to go around to the front? It's my fault that that kid's no longer
Hmm.
alive if I had just gotten there sooner, right? So that would be another example of moral injury through that pathway of perceiving that I didn't do enough or I should have done more. Suicide falls into this too. So suicide um, is an event that could lead to the loved ones of the deceased developing moral injury from, I didn't see the signs, I should have said more, I should have done more, I should have responded faster. How did I miss that? If I had just known that, if I had just seen the signs, maybe they would still be alive. I could have done more to keep them here, for example. And then the third pathway is one that we see very often in first responders too, and it is developing moral injury because someone perceives that an individual or some kind of organization or system at large has led them to go against their moral code or value system. That, either it's led them to directly engage in some kind of action that goes against that, or it's just preventing them from living in line with their value system or moral code. For example, working with a paramedic who was told to stand down and not provide a certain procedure that they think could have been life saving for this individual, and that individual dies. Working with military, who, of course, you have to obey and listen to the superiors. If you don't, you can go to jail. So someone knowing that, like, hey, this isn't the right thing to do, but they have to obey, and they do, and it leads to casualties or things that go against their moral code. um, I've worked with law enforcement officers that had to enforce certain policies, let's say around homeless encampments. And even though they didn't necessarily want the homeless encampments to be there, they said, the way that they were expected to confront these individuals was in such a harsh manner, in such a harsh way, that this individual felt like it went against their Christian moral code, for example. And they suffered from a lot of moral injury from what they'd seen and what they felt like they had to participate in as a result of that. So those are just a few examples of that. So the three pathways to moral injury.
Yeah, thank you. That is a very concise and clear way for us to kind of understand where these might fall. And I appreciate the examples. And as you explain these three, I can see how some of these may overlap, right? So even number three being like the organization or the policies dictate whether you think you can do the job, per what your character and your values would suggest or would dictate.
Yep, 100%. And yeah, they can kind of overlap a lot, right? Of with especially if there's like an organizational impact on either in an instance preventing me from doing what I think was right, or just as a whole, kind of the wear and tear on, like, this is just pulling me further and further away from who I am as a person and my value system, which just can kind of chip away. So there could be an aspect, through that third pathway of almost like betrayal in some way, that I've been betrayed by that system, and that system has betrayed me.
Yeah, and that's what I wrote down next to organization is betrayal question mark, right? Like organizational betrayal, administrative betrayal. These are phrases that we hear more often. I think they're becoming more familiar to us and very
Yep.
relevant in this
Yep.
in this conversation.
Yeah, that institutional betrayal where it's and I talk about this a lot. Sometimes it's not necessarily about the event itself, but what happens in the aftermath of it, when, as it relates to, let's say, like an agency or an organization, and how they handle that and how they treat their employees and what their expectations are, that can then actually breed the moral injury in that aftermath, as opposed to related to that exact incident, if that makes
Hmm.
sense.
Yeah, it certainly does. And so the examples are very clear. We all talk about them frequently, right? We talk about, well, what's the risk reward if we go down this path, if we pursue that car, right? And so I think it's easy for us to wrap our heads around when there's a significant casualty, loss of life, that kind of thing. But I also want the listeners to pause and reflect on how the smaller things just create that little like gut wrench or that, kind of that stab in your chest where sometimes it might be like, hey, statute says you will arrest this person. Meanwhile, everyone's like, we don't want you here, and everything was fine, right? And so that's not me making commentary on the laws. That's me making commentary on how it feels when you're like, man, I've seen this type of situation a lot of times. I feel like this practice aggravates it. However, that's our role. It's just explaining and just recognizing that you can have these emotions and impacts when you're well intended, but there's pathways that you don't have access to, and there's pathways you're kind of shoved down this groove at times.
Yeah, and to your point too, this, when we're thinking from like a research perspective, these would be moderating factors, meaning that they can increase risk or kind of pave a clearer way to moral injury. They themselves don't necessarily cause moral injury, but they can really create an environment for it. And I see it a lot, particularly with police officers, right? And just kind of the perception, societal perception, or what's trending in society of like, police officers are bad or this or that, or whatever it is that can really, like you said, kind of the little things that can kind of chip away, and then again, just kind of increase risk for some of this. I like to use the example of, as someone who has been, fortunate enough to work with military veterans from eras dating back to the Korean War. There is a big difference in, generally speaking, generalizing of kind of the impact, the themes of impacts across the different eras. And so, like the Vietnam War era combat veterans,
Hmm.
it's very different in working with them because they came home and they were spit on, they were called baby killers, they were all of this, which really complicates and contributes to what they were dealing with mentally in the aftermath of their combat and warfare.
Yeah. With that, and I'm not trying to take too much of a deviation, but I remember this concept of analyzing these types of responses with warrior cultures or warrior supportive cultures, where some contemporary nations and societies, it's very normal and it's actually baked in. Where if you're adult age, you're going to sign up for the military if you're military eligible, and how sometimes that reception and support from the community just by happenstance of how the society is structured can help alleviate some of that. Do you see that on a scale? And because you practice and you talk to first responders and military all across the nation, do you see any correlation anecdotally or from your perception of more supportive law enforcement communities or dare I say like red states, blue states?
Anecdotally, yes, 100%. It's
Hmm.
very different. And even like there can be a red state with a community that's
Yeah,
not particularly
absolutely.
supportive of
Hmm.
law enforcement or vice versa, right? But
Yeah,
more so around the lines of like how supportive are they in their, or how supported are they in their community? What is the general mindset? What's the general message about law enforcement in that community? I think anecdotally makes a really big difference. Now, that doesn't mean that that in and of itself protects someone from something like moral injury or
no,
PTSD or
yeah,
anything like that. But again, when we're thinking kind of like what we look at in research, these are um, important factors that can influence increase risk, decrease risk for some of these things.
yeah. No, thank you for helping us start with, identifying what this is and some contributing factors so that we can understand it. And now that we're a decent way into the conversation, I think a lot of people start thinking about things that are contributing or different examples in their own lives or careers. Where would you start? How do people start recognizing things they can do to navigate this? Because this is just going to be a part of life, part of career.
Yeah. So a couple of different things. When I'm say giving a training or training peer supporters on this, um, one of the main things that I think is really really important is understanding the why behind why some of this can come up, right? And then understanding where the road that goes from that why to then developing something that's really impairing and causing a lot of problems in someone's life. Okay. So it's not overnight, is what I'm trying to say. Just like PTSD does not happen overnight. There is a road from normative, objectively normative stress, post traumatic stress symptoms, all the way down the line to PTSD, right? And it's the same with moral injury. So it is adaptive and normative and not immediately problematic if someone feels guilt in the aftermath of some kind of incident. If they're wondering, could I have done more? Thinking about that, we have guilt for a reason. It is a evolutionarily pro-social emotion. We experience it either when we want to try and amend some kind of rupture that we think we've made in our tribe, right? That's important to make sure that we uh, don't continue to piss off our tribe because we do, they're kicking us out and we're not going to survive.
Right.
But it also is there to try and uh, prevent or decrease the likelihood that we're going to engage in a similar transgression, right? Or in a case of omission, what could I have done differently so I can make sure this terrible thing never happens again, right? And so normalizing these things is really important. We do not immediately pathologize, meaning say like, oh, this is a problem, we need to address this. If someone's asking these questions, if someone's experiencing mixtures of guilt and grief and all these things in the aftermath of a tough incident, for example. So I think that is one thing that's really important, is understanding that that in and of itself is not problematic and why that comes up. But where it becomes problematic is the same road that leads to PTSD. And I think I might have talked about this on my first show here. Okay. Is that when someone engages in avoidance around these really difficult and distressing thoughts and emotions and experiences, that is where that ball starts to get bigger and fester and grow and grow and grow. And that's how it leads to things like PTSD or moral injury or alcohol use disorder, right?
Hmm.
This is the road that leads to that. So what happens is if someone's grappling with these difficult emotions, thoughts, and the aftermath of some of this, but they're good. I'm fine. You fine? I'm fine. I'm fine. They don't talk to people. They shut down. They distract themselves, whether it be through alcohol or porn or just keeping themselves busy. They have they completely keep someone at a 10-foot distance emotionally. I'm good. They don't talk about it. They don't ever say out loud what's going on. They don't ever express any of that, so on and so forth. This can then increase the risk for that, actually, like I said, think of it like a snowball just going down. The grade gets steeper and steeper, accumulates sticks and rocks and other shit, in it, and then it becomes more problematic.
Yeah. Yeah. Thanks for explaining it that way. I mean, I'm a avid believer that if we bottle things up, yeah, it's going to be the pressure cooker. It's going to not only come out at some point, but it's going to come out worse. And or you could make the allegory like, hey, if you don't address that thing, and I'm not telling you how you need to address it or visit or hold space for it, but it's the black mold, right? It doesn't just go away; it gets worse and worse. And now, what used to be a simple cleanup with some bleach and a sponge might become a whole like a restoration, calling in a specific like remediation company, which is what we see. It's not to disparage it; it's just to draw that type of comparison.
It's a great analogy, and it's not, what you're saying is not just your opinion. It's now scientific. We now have the neuroscience and the technology to show what's actually happening in the brain at this time. This is scientifically proven, okay, that through these routes of, we call it avoidance on the clinical, on the psychologist side, but through these routes of bottling it up, whatever I do to try and prevent feeling these natural, yes, very difficult, but natural processes like grief or guilt or fear or whatever it is, more I try to get rid of that by doing this or avoiding that or whatever it is, bottling it up, it actually changes the neural circuits in our brain. That's what leads to the development of some of these things. And so what sometimes I get asked the question, what's one thing you wish people know is that it is not the experience of, let's say, guilt or significant grief or distress or fear or anger or the acute stress symptoms after a tough call of like being jumpy and all that. That is not what actually is problematic. What's problematic is when someone goes to great lengths to try and suppress, eliminate, or get rid of that altogether. That's what
Mm.
actually leads to the problems.
Yeah, yeah. You said a lot, and I almost, I mean, before I lose sight of this, I think where you started with peer support, how do we help someone navigate that? We normalize it. The great thing that connects all this is that if we are grappling with this as a peer supporter or as just a colleague, a place that I've been many times where people have said, and I've said to other people, the same types of examples that you shared, right?
Mhm.
Like the guy that found the kid when it was too late, and that guilt of if I should have done this or if I went that way. My gut was saying check here, but no, I had to go here first. Like the fact that they're discussing it is a huge uh it's an awesome thing, right? So if you're a peer support, I'm like, man, how do I help my person through this? Or if you're a chaplain or somebody, like already the discussion's happening, so you're on a great track is what I'm
Mhm.
hearing.
Yep.
And then normalizing it, and I a lot of times, like, how do you help someone see things more objectively, or even for yourself, like, switch roles, right? Like, hey, if this was not you and you heard this what you are saying out loud, if you heard me saying that, would you agree with it or would you disagree? And generally, or you heard your other buddy say that, they'd be like, "No, I'd smack them because it's not fair, it's not reasonable, it's not true." And you're like, "Well, here, there you go." And usually you have that sigh or that like, in my experience, that kind of shoulders go back, and that it's
Mhm.
almost acceptance and recognition, like giving themselves permission to not continue to guilt themselves.
Yep. Yes. And then on a on a clinician side, if I'm working with someone from there, if they're like, "No, I wouldn't expect Eric to, I wouldn't blame Eric or think Eric's to blame for this kid no longer being alive. I would never think that. Why like it has nothing to do. It's not his fault at all." Right? But I still feel, even knowing that, I still feel like this,
Mm,
right? I still
mhm.
feel like there's something else I should have done. And as the clinician in moral injury work, when we're doing what's called trauma informed guilt reduction therapy, then we go in and we understand what the function of that guilt is, because there's something there, meaning that if I no longer feel this guilt, then what does it mean? So in many cases, let's say in that example, it'd be if I don't feel this guilt anymore, I'm dishonoring this kid's memory. This kid had no one to look out for them. And if I don't feel guilt anymore, I'm dishonoring their memory. I'm letting them go. No one's going to remember this kid if I let this go. Right. And so we go in and kind of address that, because on an objective level now they understand, sure, objectively, there's nothing else I could have done. And yet I still don't want to take off this backpack of guilt bricks.
Yeah. Yeah, it's like we are not fair to ourselves, we're not compassionate to ourselves at times, and we don't wanna let go of that pain. It's almost like the reluctance to shift from mourning to celebration of life, right? After we lose a loved one, or in this case, it's like that bond is strong of like, I was supposed to be your protector. I signed up for this thing. I swore an oath. I devoted my life to this, and I wasn't there when you needed me to be.
Mhm. Yep. Yeah. Exactly.
Yeah. That's a lot, and I appreciate giving, some some conversation and some tips and kinda strategies of how do you navigate this. We talked about the individual, and I'm curious if you have some quick tips for those emerging leaders, those informal and formal leaders, kind of the first lines, the peer supporters, those that are looking out for those around them. Like, what are some things that you would suggest they keep in mind as they help their people? Because these things happen, daily in and out in
Yeah.
small and big ways.
Yeah. So one thing I like to tell my peer supporters and my folks is that you don't have to fix everything. And very, very well intentioned peer supporters or officers or first responders trying to help their peer kind of jump into the fix it mode, right? And most times, with rare exceptions, it's actually counterproductive to jump into fix it mode. Especially if we're going to stay along the lines of like someone's experiencing what we would call moral distress in the aftermath. It's not moral injury yet, right? In the aftermath, remember, it could be normative, but it could be moral distress, like signs of that, of like, hey, maybe I should have done this, I should have done that. I'm feeling really guilty. Like maybe the kid would still be here. If we're hearing someone say that, one, it's very good that we're hearing them say that. That's a plus instead of them just keeping it in, right? But also, I think we inadvertently want to fix and take that away, right? And so most times what's most powerful is not fixing it, but showing up and being there and listening and not necessarily trying to convince someone, hey, no, 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 it's not your fault. Actually, I highly advise against that. But being there, being present, And then also providing objective commentary. And what I mean by that is, let's go along with this example. If you're the person telling me and I'm a peer supporter and you're saying like, I don't know, man, I just feel like I just keep thinking I shouldn't have gone through that front door. I should have I don't know why I did that. If I had just jumped the fence, the kid, I could have maybe gotten to the kid fast enough. And like, I don't know. I just feel really sick to my stomach about it. And like, what, I could have maybe changed the outcome. Maybe they'd still be alive, validating, like, I hear you, what you're saying. I hear how much this is impacting you. That would mess me up too. I've been there if you have, right? And I know
Hmm.
what that's like. Uh, you know, how do you know that the outcome would be different? I mean, how were you supposed to know that the front door was locked? How would you have known to immediately how would you immediately know to do that, to go around to the fence, right? Just kind of adding objective commentary to it so that you could just talk through this with this person instead of immediately going, no, man, it's not your fault. Come on. No,
Hmm.
you did. No, not your fault, not your fault, not your fault. Because it actually prevents the brain from processing the way we now know it processes in these situations. Instead of kind of like trying to confine it and squash that, we want to kind of open up the room inside, so to speak,
Hmm.
metaphorically, so that this person can kind of run through naturally through this cycle of what they're doing right now. That in the long term actually leads to better outcomes. So I'd say number one is showing up, being present, not trying to fix immediately, and not trying to convince someone, of course you didn't, this isn't your fault. Of course not. But if you say, I'm having trouble seeing like how it's possible that you would have known, can you tell me how you would have known? That's objective commentary as opposed to, no, man, not your fault. Come on. It's not your fault.
Mm. Yeah.
That makes
Yeah.
sense?
Yeah, absolutely. It's a great theme and reminder for peer support. A lot of people really pour their heart out and they put their true like passion into that role. And it's not a fixer, right? You're not a manager slash firefighter type. And that's not the career. That's just like the response type. And so it's peer supporter, not peer fixer.
Yeah.
And we can apply that to our relationships outside of work too, right? Where how often does your loved one say, yeah, I don't need solutions right now. Like, I'm just trying to talk to you, and I would love
Yep.
you to listen. And hopefully, you
Yep.
have that type of direct conversation that comes out at times. But yeah, I find myself there all the time. And I think because we mean well and we care and we are problem solver profession types, that's
Uh-huh.
where we default. And so it is to recognize, like, yeah, the role is not help you get over it because it's uncomfortable. It's like, no, I'm here with you,
Yep.
and you're not alone.
Yep. Exactly. That's the most powerful. And I can say, even when if and when someone gets to the point where they need help, it's become more problematic for them in our evidence-based treatment for moral injury. I'm also doing the same thing to a different degree of what I just explained to you. In treatment for moral injury, we're not, okay, let's assess the situation. Yes, objectively you did nothing wrong here, so let's work on making you realize you did nothing wrong here. Actually, the treatment goal of moral injury is not to convince or make someone realize that they did nothing wrong. If that's the case, it has nothing to do with that. It's actually about, kind of intervening in that avoidance cycle. And like I said, kind of making more room in the brain as opposed to, it's my fault, it's my fault, it's my fault, and I don't care what else comes in.
Hmm. Yeah. Is there something that, going back to the avoidance being such a catalyst for more maladaptive behavior and the problem growing, is there something that you would say to the peer supporters that do know that somebody, maybe because they are so close with them, is strongly affected, but they are shoving them away and they are recluding?
That's a good question, and I get it often. It's the old saying, you could drag a horse to water, right?
Hmm.
Your role as a peer supporter is to, be there, be willing to be there, be present, let them know that you're there. Beyond that, there is some personal accountability to being willing to accept, receive support. And I like to say that a lot, when I'm training peer supporters and training them on critical incident response and debriefings and things like that is, personal responsibility is a big part here, right? It's important that we provide structures and resources so that someone can get the support they need. But if that support's there and they're making themselves known and that they're there and willing and ready to offer that support and someone is doing that, you know there's not
Hmm.
much else you can do in terms of, forcing it.
Yeah. Yeah, I like the awareness and the permission for us to be like, "Hey, I'm at any moment when you're ready to just meet me a little ways, right? I'm there, right?" So I've given this like allegory where it's like you have the life preserver on the side of the ship, and there are some people that absolutely need it, right? They're not in a capacity to grab it themselves, so we're totally willing to jump off the ship and grab them and keep that life
Yep.
preserver. A
Hmm.
lot of these situations when we think about peer support, I liken more to they're swimming away from you and or they're flailing and they're just not in a place to they're capable to swim, but they don't want the life ring. And then so where does that leave us?
Yep, and they're just kind of like coming up for air, and they're not drowning necessarily at the bottom of the ocean, but they're struggling there, and that again for my peer supporters is like just acknowledging that that's really hard
Hmm.
to be that person and to be like, I see this person, I know they need help, offering help. We've tried to help them, and they just keep batting it away. That just sucks. There's no way to make that not suck and to not make that cause certain feelings and thoughts and emotions in the peer supporter, and acknowledging that, kind of doing the same thing of like acknowledging that sucks. It's a crappy situation and it doesn't feel good. Without letting it be like I failed them, I'm not doing my job well as a peer supporter, da 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 da, da, right? Which is sometimes what I see is that's where it gets taken past that point. But acknowledging the suck is a pretty powerful thing, actually.
Yeah. Yeah, I know we're getting close on time, and one thing I do want to ask you because you talk to first responders of all types and roles and ranks, and I want to nudge to the bigger bosses, right? Command staff, executives, chiefs, sheriffs, bat chiefs and such. I guess bat chiefs more like a middle manager, but you get what I'm saying. Um, what would you say to those that are hearing this conversation? They're in those roles, or they're going to be one day and they don't want to create moral injury unnecessarily, but they want to recognize it and even their own level of that, right? Where they are making decisions that are not a 100% net gain, right? They recognize that there's some things that are the intended positive consequences, and there's also some downstream negative consequence and effect on their people and their people's well-being and morale.
Yeah. So if we're going from, some anecdotal themes that I've seen working with officers, line staff, et cetera, what I've heard that they, struggle with or wish command staff or, higher leadership, what they wish they knew or what, leadership should know that they struggle a lot with is one kind of going back to that point of not necessarily fixing everything. But what I see time and time again is for those who have leadership that show up, and show up can mean a lot of different things, but that they feel they consistently show up, not like they show up to the ceremony and they're physically there just to make face and then they're gone, but actually mentally and emotionally show up. But those seem to be the individuals that have, the healthiest, departments with good morale, et cetera. So, people notice when supervisors, command staff, when they avoid difficult things. People notice when people are doing things just for show and they're just showing up and they write their book and they talk about what being a leader is, but then at their own department or agency, they don't really do any of that. It's kind of like, look at what I do, right? And so I think showing up, even in difficult situations, even in a situation, showing up. How are you doing after that? How's everyone doing? Or even I know this broader situation going on in our department sucks, and just acknowledging that, and not necessarily that they have the power to change it or that, hey, here's exactly how I'm going to meet your needs to make sure that this stops sucking for you, but just presence is more important than all the other stuff is
Yeah.
something I find a lot.
Yeah, that's a lot, and it's also kind of empowering that, you don't have to have all the answers, and more we can recognize that, like, how many times have you had a leader that has shown up, maybe well-intended, but they're trying to fake it till they make it, but you can kinda see through it, and you're like, "Man, just say it. Just be real. Say it sucks, you're not sure, but but ask the question, stay curious, and a little bit of trying, a little bit of listening, and intention and presence, as you said,
Mhm.
goes a long, long way. And so
Yeah.
I love
I
that for
I like
emerging
that,
leaders.
stay curious, what you said, that's a good way to put it, is like the curious leadership and command staff, I feel fare better with their personnel,
Yeah,
the curious ones, so to speak. I think that's a really good way to put it. And, something else that comes to mind too is it's the little things that contribute to um, morale and, someone's satisfaction within the agency. Meaning that, not to say that, hey, if you're in a leadership position, every wrong thing you say, but you better be careful, right? But this understanding that it's not, oh, well, I did that one thing, I did that, I made sure I did this thing, but on the day to day, the small things that the personnel, the staff are not feeling connected, they're not feeling heard, they're not feeling looked after. That it's the little things. They remember who checked in, they remember who defended them, they remember who was curious, even if they couldn't do anything about it. They remember all of that. And so leadership credibility, from what I've seen, is accumulated over hundreds, thousands of small moments.
yeah, yeah, 100%. Well, that might need to be our next episode, right? And like these things that you hear from different perspectives, how do we all recognize like we have a piece of it? No one has full control. We have the biggest vote in our own personal morale, but it absolutely trickles out to those we work with and leadership, I believe, and many do too. Like when you ascend in rank, you have volunteered to take a larger portion or a charge, right? A responsibility for your part in that. So, man, Dr. Brooke, thank you so much. Please, quickly let people know where they can find you, reach out and find your work and what you're working on.
Yeah, absolutely. So you can find me on Instagram at Dr. Brooke PhD. So that's the full word doctor, then BROOKE PhD. And then if you want to learn more about what I offer and what I do, you can find me on my website at www.centertas.com. So that's centertas.com, centertas.com.
Awesome. Thanks again, Doc.
Thanks for having me.
Thank you for tuning into another episode of Blue Grit Radio. As always, support this community by subscribing, giving us a 5-star review, and following, liking, and sharing posts on Blue Grit Wellness on Instagram. You can reach me there or email me at bluegritwellness@gmail.com. Be well and stay gritty.